Torches illuminated the center of Buenos Aires on Wednesday. They were carried by nurses from Argentina's capital to demand better salaries. LORENA DIAZ says public healthcare workers are exhausted and underpaid.
In my hospital, there are COVID patients on every floor. We have friends that got sick. Our salary leaves us below the poverty line. We have to work in several hospitals to make ends meet.
Healthcare workers are also victims of the economic crisis in Argentina that's been exacerbated by the pandemic. Purchasing power has been weakened by the double-digit inflation rate that's been haunting Argentina for years. But in this hospital in Moreno, outside the capital, the situation is even worse. Nurses say they haven't been paid in 6 months.
Hospitals and health centers like this one in Argentina have been struggling to cope with the rise of COVID-19 infections. Doctors and nurses say that they've been working non-stop since the pandemic began and that they were summoned by the government to deal with a national emergency. Until now, they've never been paid.
SOLEDAD BERNAL says they're desperate, and that's why they started protesting outside the hospital.
All of us continue to work even though we are not paid. We are all work with COVID patients. We lack basic items like syringes, but we are here trying to care for our patients. We don't know when we are going to get paid.
There's about 120 people in a similar situation at the hospital. Some of them are about to be evicted from their homes because they're unable to pay rent. Labor unions are distributing food to those struggling to make ends meet.
Most of the ones working here are women, and we are vulnerable over how we are treated. We are helping patients, but also our families, and we do all this without a salary. Many are afraid to speak out because they are afraid to lose their jobs, even though they're not paid.
Argentina is battling an economic crisis and a pandemic that has left more than 10,000 people dead in the past month. The government has shut down schools and imposed a curfew to contain the spread of infections. But for more than a year, hospital workers have provided the front line against COVID-19. And they say that if they are to carry on effectively, they need better wages. Teresa, Al Jazeera, Buenos Aires.